Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 9th, and this is my daily briefing. And I'm just going to let you know up front, you might hear some background noise on this video. They're doing some construction on the street behind me, so I just want to apologize in advance if that's disruptive. So we currently have 26 cases in Missoula. There are 354 cases in the state of Montana. There have been 6 deaths in the state, with 1 in our county, and we've had 14 recoveries to date in Missoula. Today, I just want to talk a little bit about enforcement. We've had several people reach out to us asking how the governor's orders and our local health department orders are being handled here in Missoula County. There's a sense that no one is enforcing things, and so we just want to make sure people understand that that's not true. The health department is charged with enforcing both the health officer's orders and the governor's directives to stay at home, only operate essential businesses, and quarantine for 14 days after travel out of the state. Inquiries and complaints are handled by our Environmental Health Division, and they've been very busy contacting businesses and individuals about complying with the orders and the directives. So when they get a complaint, they first reach out to the business or the individual, and they have a conversation about the order, why it's important. They talk about what needs to change. Often this is all that needs to happen, and both parties come away with just a better understanding of how to fulfill both the spirit and the intent of the orders and the specific requirements. Environmental health staff have found that most community members are willing to comply, and sometimes they just haven't thought about how the governor's directives actually apply to them. In addition to responding to complaints, questions, and concerns, our environmental health staff have also done a lot of spot checks to ensure that bars and restaurants and other businesses are operating in line with the health officer's orders and the governor's directives. In almost all cases, they found that the businesses are complying, or they just need to adjust how they're serving their customers just to further limit the potential for exposure. It's true that not all individuals and businesses are immediately receptive or compliant. When the first health officer's order to close restaurants and bars was issued, the health department elicited the help of the Missoula County Sheriff's Department, and deputies did visit with a few bars that were still operating despite the order. Later spot checks showed that those places were in compliant with the order, and environmental health staff also work closely with the Missoula County Attorney's Office, who have the authority to enforce the health officer's orders and the governor's directives. The county attorney's office has additional tools in place to convince businesses and individuals to comply. So the bottom line is that the orders are enforceable, but the reality is that we hope that instead of using a ton of resources forcing people to comply who are trying to get away with something that is risky, we want to rely on individuals and businesses to take the restrictions seriously and to do what's needed to slow the spread and keep themselves and their employees and their customers and the community safe. The more people who stay at home, work from home, and limit visits to even the essential places like grocery stores, the better chance we have of flattening the curve and not overwhelming our medical infrastructure and ultimately saving lives. So if you have questions about essential businesses or any of the orders, or if you have a complaint, you can email our group at envhealth@missoulacounty.us, or you can call them directly at 406-258-4755, and they can certainly help answer any questions that you might have, or they can respond to a complaint. So you may have seen our Facebook post last week on scams that are surrounding the COVID-19 incident. Scammers are definitely taking advantage of fear and manipulating people by email, by phone, and by text. There are some dangerous ones related to your health that I want to talk about today. If someone calls you trying to sell you a low-priced health insurance, it's most likely a scam. So please just hang up on robocalls that are claiming to be health insurance or health services. It's important to ignore online and phone offers for vaccinations, home test kits, and cures for COVID-19. There are no approved vaccines or pharmaceutical interventions for coronavirus, and the only approved tests are through a medical provider. This last one is important as there are many rumors that are going around about tests and treatments. There's some clinical trials that are happening right now to look at pharmaceutical interventions, but none of them have been proven effective or safe for this application. The scammers and rumors of miracle cures are really dangerous, not just because these supposed treatments might not work, but some could actually be deadly. So taking things that haven't gone through the review and approval process or taking drugs without the supervision of a medical professional can be dangerous. You've probably already heard about the people who have self-medicated with chloroquine phosphate and have died. Hydrochloroquine is not approved drug for other medical conditions, not COVID-19, and it can definitely have some severe side effects. Dr. Fauci of the NIH and the FDA do not see that there is enough evidence to say that this drug is effective at this time. Companies that are selling teas, tinctures, essential oils, and colloidal silver have also gotten warning letters or cease and desist letters from the FDA for making fraudulent claims to cure or prevent COVID-19. None of these products have been reviewed and their claims have not been validated. So none of them have been regulated to ensure the standard and effective product. We hope that ongoing research and innovation will provide more options for testing and treatment and prevention, but right now we just need to stick with the prevention behaviors that we know will work, like social distancing, staying at home, hand washing, and face coverings to prevent you from getting someone else sick. As always, it's important to just maintain all of those measures that we have put into place to help protect our community and protect your own loved ones. And that's it for my daily briefing. So you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so that you are notified when another video is uploaded. Follow us on Facebook for really great information, the Missoula City County Health Department. If you have any questions or you want to see if you are eligible to get tested through our drive-through testing facility, you can call 406-258-INFO. That's 406-258-4636. So thank you for everything you're doing out there in the community to help keep our communities safe and healthy, and I will talk to you again tomorrow.